Nick and Megan, listen, first of all, thank you so much, most importantly, for leading on the front lines of the COVID-19 pandemic. And thank you for taking the time out of your busy lives to chat with us tonight. I know how tired you must be. This COVID reality, I think, has revealed the American DNA of leadership at the community level. And you made both the choice to deliberately serve during a time of greater risk. So share with us as you know, the marriage team and as parents, the decisions that you made in deciding to serve during this difficult time. We'd love to hear from
I think for me personally, there was no real decision. There was never a choice. I went into healthcare to help people. And when people are at their greatest need, there was no other option than to continue to help them. So there was no real choice for me. It was just a natural transition into continuing to deliver care. So that was my experience.
you. Well, let me ask you this: how you've got a 6-year-old and a 3-year-old, and they have some understanding, I think, of it's a unique time for mom and dad.
Mhm.
How did you? And we'd love to hear from you as well, Nick. But how did you guys communicate it to them that these are unique and different times, and mom and dad are still helping each other? But how specifically did you do that?
We were very lucky. Our older son's school talked a lot about coronavirus as it was happening, and they had met with their school nurse and went over hand washing and virus and spread of disease and things like that. And really, they took a lot of the burden off of us of explaining it at that level. I think that we also are very fortunate in that we have tremendous family support, and so they've helped us to kind of explain. For example, I was working on Easter, which is very unusual for me to work on holidays, and they helped kind of jump in with the kids and take over and explain why I had to be at work. And our younger one has some understanding of what's going on. His world has also been turned upside down. So he asks some questions, but generally for them, we've tried to keep a routine and just keep things as normal as possible so that they don't get too nervous or stressed or worried about it.
Yeah, certainly routine is very important. Nick, we want to hear from you and your time with the VA, but you told a story about how your children are stepping up to help, and your 6-year-old is offering to make omelets.
Yeah, the good thing about kids is they're adaptable, and you kind of throw them in any situation, and they'll adjust and make the best of it.
Yeah.
And we're fortunate we have 2 little boys, and they kind of try to run the show. So there's always some headbutting going on, but it's pretty fun. I was pretty happy to see that they my older one basically got pulled out of school just one day, didn't go anymore, and now school's been canceled for the year, and he's taken that pretty well. He still has Zoom meetings with his class a couple times a week. He's doing online assignments. The teacher's very engaging with him. They have a YouTube channel they use, so it's been good. It's that obviously it's difficult for us. We're still both working full time, so we don't have the option to stay at home and be teachers at home and parents at home and go to work as well. So it's been a little bit of juggling to get the support and everything worked out, but we're making it work.
Well, you both made the decision, and again, we'd love to hear how the omelet turns out. So share that with us when it's finally done. But Megan, you said it wasn't a choice, and I love that part of it. It's a calling. You want to help others, and that's what you guys do. You're now working in a COVID positive ICU, so you are at the front lines. Share with me a little bit and us, what were you expecting? What has surprised you? There's so much in the media and on the news about what's happening, but the ground truth is right in front of us with the both of you. And what surprised you? What have you learned along the way? And really, what do you think people should know that they don't?
So in my normal life, I'm a trauma nurse practitioner. So I work for a group of critical care surgeons. And when we heard that the hospital would be turning our critical care units, our surgical critical care units, into medical critical care units to take care of COVID positive patients, we knew pretty early on that we would be called upon to work in these units. Now, in my regular job, I don't do critical care. So luckily my hospital kind of started us early before we had a lot of patients. So we got a lot of training. We've been on Zoom calls, learning all about ventilator management and things that I just don't do in my day-to-day job. So we've had a lot of support from, the surgeons that I work with and learning everything. I've been on the unit for about 3 weeks now, and it has been very surprising just how sick these patients are. And I think the hardest part has been that this disease is such a moving target and we just don't know anything about it really. We have some general ideas, people have general, early research about it, but we don't know exactly how to treat it. And it's very frustrating having a patient before you where you're doing all the things are right and it's just not working and we don't know why. And so I've been actually very surprised by the level of creativity that I've seen. We're trying different things and it's a trial and error and trial and error. Medicine is a science, but there's definitely an art to it. And I cannot say enough about the surgeons that I work with and the leadership that they have shown throughout this. It's also very hard. So a lot of the research we have is very early, but then we also don't trust all of the research that we have. So that has been very challenging. And then I think one of the hardest parts on a personal level is walking away from work. And this is something you experienced through the military, which I have not really experienced much of. This is such a politicized disease and time. And so to be kind of in the midst of it, and then when you walk away from it, everyone on the street has an opinion. And you're like, wait a second, you don't know what you're talking about. So that has been very challenging. I've been on the outskirts of that for the military, but being in it myself has been pretty amazing. But yeah, the major takeaway I would say is that this really is a moving target and we don't know yet the best ways to stop it. We don't know the best ways to treat it. And every day I go to work, I'm learning more about it and I'm learning how to better take care of these patients. And that's all we can do right now.
No, that's great to hear. We're getting better at it. And I do empathize and hear you loud and clear on how you're trying to just do the right thing day after day, and everybody walking around has a strong opinion of what right looks like, and all we can do is focus on the problem in front of us. But I appreciate that. Nick, what about you? The VA, sometimes, often it gets unfairly indicted in the media, and there's a lot of great care being delivered in the VA. Tell us about your experience and how you think the care for our veterans is going on now.
So I have had nothing but positive experience through the VA. I know that there has been some bad press and maybe some bad things that went on at certain facilities. And I have not personally experienced that. I have patients on a day-to-day basis that have just this outpouring of love with how much they appreciate the care that they get. And I appreciate being part of that. There's nothing greater for me in my life than to serve the veterans that served our country. I think it's our greatest asset and we need to take care of them, and we do. And when this whole thing hit, I work at the Providence VA, Providence, Rhode Island. They were kind of right on the ball, and they jumped on with establishing parameters with everything we were going to do and refocusing all of our assets. We had to unfortunately, close a lot of clinics. A lot of the outpatient stuff needed to go, and that's tough to tell a patient you can't come in for your routine visit, because that's, people expect that kind of care. But when you're looking at the, bigger picture and you say it's for your safety, we don't want you potentially being exposed, so we're not going to have you come in. Yeah. And a lot of people, they understand, and a lot of the veterans are they don't want to come in. They say, I'd rather just avoid places where people are sick right now, and that makes sense. But we were fortunate, our directors did a great job of shuffling around people and getting people into different areas that kind of are helping with this whole thing. We established full units and full floors that are, COVID only, put training in to the staff to staff that. Currently, I'm doing the So COVID intake, basically. So when patients come to the hospital, we have a very stringent screening process. You can't just walk in. You have to go through, a very, various triages. And basically, if you show any signs of being COVID positive, being exposed to COVID, you're going to get kind of stopped, and then you're going to get assessed further into, more depth. And that's what I'm doing right now. So I get to see people as soon as they come in, establish if they are at risk, and go from there based on what's going on and how they're looking. But I would say in general, if you are a veteran and you get your care at the VA, I think you should be happy to know that we're doing the best we can. And I was going to say that the big takeaway with all this, especially with medicine, is everyone's doing the best they can. No one has the magic pill that cures this. And so we're readjusting day to day. I mean, the VA is sending us daily emails about this is what we're doing now. We're adjusting this, we're doing this. So, I mean, it's a day to day thing. We're taking research from today and we're applying it tomorrow, and that's how we're going to beat this. And that's how we're going to kind of get over this hump and get back to whatever normal life is going to look like on the back end of this.
Yeah.
But I'd say I'm proud to work for the VA. I really am. And, I think we're doing a damn good job. So,
well, we're certainly proud to know you both and remain so thankful that you're both on the front lines. I think one of the things that's always been so interesting to me, and Megan, you really spoke to it, where people are suffering and it's a moving target. And one of the things COVID seems to have revealed that those who are suffering don't have access to their families to come see them. And that must place an added burden on caregivers like you. How does that impact you all, where they're really searching for you for not only the medical support and conclusion, but that spiritual and emotional support, because they're not getting it from their families who can't come see them?
That has been one of the hardest things to watch in person. But, you do the best you can, and you try to. We've got iPads now, and we're having all these people FaceTime with their families that can, and we're just trying to be creative. And I see nurses routinely, like, they can't get the iPad, so they just bring their own phone in and they FaceTime, or the family doesn't have a FaceTime compatible device at home, so somebody will just bring in the right device and get the person to their family. And one of the roles that I'm taking every day is I like to be the person who calls family members at home and just has a conversation with them and checks in. Because for me, as a trauma nurse practitioner, I love my experience interacting with my patients. And most of my patients right now are intubated and on ventilators, so you don't interact much. So I've been kind of replacing that with interacting with the family, and that gives me a lot of satisfaction. And in doing so, it helps to make that the painful situation of watching somebody suffering without their family, it makes me feel better. And in doing so, I hope that I make somebody else feel better.
Yeah. I mean, that's great. I appreciate that. And, it's 8:40 on the East Coast. You both have had a very long day. How are you taking care of one another? You come home and you got kiddos that want mom and dad, and you guys want some downtime. How are you guys? You mentioned the need for routine. Family can provide that stability, but these are unique times. How are you guys supporting one another after really long and trying days?
I know for for me, golf is canceled for the foreseeable future, so I find myself with about 30 extra hours a week.
So it's been pretty awful.
No, but it's been tough because we had pretty our routines were pretty set in stone. Like, we knew what days we work and what times, and now things are kind of shifted. I'm working much earlier, much later, longer hours. Megan's working rotating shifts, weekends, nights, holidays. So it's, we're not used to doing that. We did that when we were both nurses, but as nurse practitioners, we kind of have more set schedules. And so the adjustment with that, it's been tough. We've had to lean on family a lot. Luckily, we have a good family support system that helped us out. And, I don't know if we can do this without them. Thankfully, we had some practice through, deployments and stuff. been in the military for a few days now, and
Yeah. Well,
been,
I want to touch on that. It's people respond to crises in different ways. And you all are military family. You're used to trying times. How do you think that foundation of being a military family who's faced deployment and danger together, how has that prepared you for this this COVID pandemic?
It was very interesting at first. I found out first that I'd be working with the COVID positive patients exclusively. And at that time, we didn't know what Nick would be doing. And I think you actually had a little bit of a hard time with
Mhm.
that.
I did.
And I was like, wait a second, what about when you go away and you're in danger and I'm home here? You're getting some little taste of what this is like. So it was kind of interesting, a little role reversal initially, but
Wow.
um, I think that being a military family, we know that we need to reach out for support. I think both of us, by our nature, during hard times, kind of turn inward, but we've learned that you really do have to turn outward.
Mhm.
And it sounds kind of crazy, but being involved in the Warrior Open and the Bush Institute has actually like kind of taught me that it's okay to reach out and it's okay to rely on other people. This is gonna make me tear up. It's just kind of helped me, especially being okay saying I'm not okay. It's really amazing to watch, a group of strong, amazing role models come forward and so many people speak about mental health. And so this experience, back to the self-care part of it, I know when I need to say, hey, I need 30 minutes to myself right now just to decompress. And I have healthy outlets that I can, turn to. Just knowing when to reach out and when
Yeah.
to lean on your supports. And, you know, Nick has been doing a great job. I've been working, like, I come home just after dinner time and Nick always has dinner ready for me, ready to go. So it's just been a nice role reversal for a little bit.
Yeah.
Like we touched on earlier, I've been getting shot at for 20 years in
Yeah.
various parts of the world. So for me, it's kind of I'm used to being the one saying, "Hey, got to go away." My nation needs me, and to have her tell me that she was going to be, on the front lines,
Yeah.
taking on COVID, and I'm watching what's happening in Italy, and watching what's happening in China. And I'm like, I didn't want her to go, and she's like, wait a second. She's like, you're the one normally, I was like, yeah, I know. It for me, it's different. Like I always felt like if I got hurt, or if something happened to me, she'd be fine.
Yep.
But if I lost her, I mean, maybe I wouldn't be fine, So,
You probably wouldn't be fine.
but
We all marry up, don't we? We
yeah,
all marry up.
yeah.
So how, now that you're both on the front lines and you recognize that risk that you both are facing, I think, to hear you say, you're cooking dinner for her, that the kids are involved, you got that family support. But you mentioned also, Megan, so well, the challenge of mental health, and for a lot of folks, and even in our Team 43 family, do you have any concerns as to maybe a wave of mental health needs that are coming our way because of that? What are you guys seeing in that lane as well?
I haven't seen anything just like clinically necessarily, but just in talking to people and just my own personal experience, this has been harder than I ever could have understood. I didn't realize how much human interaction I have every day. And, limiting that or getting it through a screen is not the same. And I'm very concerned about the mental health of our country. I'm very concerned about the mental health of our children. Um, for, our 6-year-old, just watching him not be around kids, it's not natural and it's unfortunate. And he's acting like an adult. And I don't
Mm.
like that. So, there's, I'm very torn about so many things, but I feel like the sooner we can get things open to any degree, the better we will all be.
Golf courses first.
Golf courses first. But obviously bearing in mind that, our physical health is also important. And so how do you
Yeah.
balance the two? And I don't think we have answers, but I think talking about it and being open is the best thing that we can do. in order to help not only ourselves but others, because I think a lot of people are afraid, because this shouldn't be hard. We're just staying home. This shouldn't be hard,
Mm.
but it is. It is.
I think a lot of people are, you have your gamut of emotions. People are angry, they're anxious, they're confused, and you can see that in, social media. People are getting mean and getting, just putting stuff out there. And it's tough. People are sad. People are not used to going and seeing other people and pointing at them in their mind and saying that person could be affected. I have to stay away from them. You're not used to having that, like, stay away from me. And we have to treat almost everybody like that anytime we go somewhere. And I think that that's difficult for people to kind of mentally digest.
Yeah, that seems like it's going to take a while to wear off, but I certainly hope it will. Have you guys been reaching out to the Team 43 family, been supporting one another, and how's the rest of the Team 43 family doing?
Yeah, we talk kind of every day.
Yeah. Yeah.
Probably talk to them when I talk to my family. But
Probably
I mean,
a good thing.
yeah, they are a family. Yeah, the Team 43. They've been instrumental in all this. Everyone kind of chats with each other and lays things out. We're not afraid to say, like, hey, having a rough day, or like, hey, what do you guys think about this? Give me your honest opinion. And that's needed. I think, especially, one of the big misunderstandings, like with military and stuff, is everyone expects everyone to be a tough guy, and it's like, that's not how this works, and especially, I think the general public seeing it now, like, there's certain things you just can't be tough through. There's certain things that you need to kind of work through, and it helps to have people to chat with and kind of work through. Otherwise, you're just going to get stuck. And when you get stuck mentally, it's very tough to kind of get yourself out of a hole.
Yeah.
You're better off learning how to, or not learning how to, discussing things, talk to somebody. You got to get the stuff off your mind.
You do. Well, considering everything you both are facing on a daily basis, I mean, thanks isn't enough. We're keeping you in our thoughts and prayers, you guys and the whole Team 43 family. I appreciate you sharing all this with us, and I appreciate both, Megan, to both you and Nick, your comments on saying when you need help, reaching out for help, because it makes you a better caregiver at the end of the day.
Yeah.
And I know now it's 8:45 on the East Coast, and we know you've had a long day, and we again couldn't be more thankful that you could join us tonight and share what you're doing in the face of this pandemic. You're both leading from the front, and we really appreciate you doing that.
Thank you very much. We appreciate the support. We really do.
Thanks, man.
Thank you.